Hey everybody, welcome to the MedLegal Green Room. I am Sam Frentzas, co-founder of the Driving Force Company, and today's guest is someone who has spent more than 25 years behind the scenes building some of the largest spine, orthopedic, pain management, and diagnostic imaging organizations in the country. He's led multi-million-dollar healthcare operations, worked alongside private equity, scaled physician practices nationwide, has helped reshape the business of medicine through mergers, acquisition, and practice management. If you've ever wondered what separates healthcare organizations that struggle from those that dominate their market, well, you're about to find out. Today, we're talking about leadership, growth, private equity, imaging, physician entrepreneurship, and where healthcare is headed next. Please help me welcome not a doctor, a CEO,
Yeah.
Doug Badertscher.
Thank you, Sam, so much for that great introduction. My mini me and I, we really appreciate that. So have my mini me on the tough days to help me with the tough questions in a tough space.
My pleasure. And I want to get into it and talk about scaling a pain practice in today's environment. Look, you were there and you could talk from what was there to what is here. And you've been in the practice management space for a long time. What do you see the difference in the challenges of scaling a practice today than, let's say, 10 to 15 years ago?
So, Sam, thank you for the question. And I have been in there a long time. If I told you the amount of time I've been in there, you'd probably push a wheelchair up. But I've been in since day one when practices first started scaling practice one. So we're going back to the late 90s when this whole industry started to change. I would like to lay down a couple of ground rules for the listeners today.
Okay.
So these are my opinions, and you will have your opinions. And we can agree to disagree, or we can agree to come together and work to better outcomes. The second ground rule I'd say is I'm a physician advocate at heart. Nothing's changed over my 25 plus years in the space. Even though the majority of my time I've worked for and with private equity firms, I'm a solid physician advocate. So you asked the question, what's changed? Well, first of all, I'll say to you, it's harder today than it was 25 years ago. 25 years ago, we didn't have practice management systems. We didn't even, our computers. My iPhone has more technology on it today. We had paper charts back then.
Yeah.
The world was just a very different place. And so let's talk about those differences and why it's harder. Let's think about the evolvement of the world, if you would. So healthcare 25 years ago was a mom and pop business, a shingle on a corner, you built your practice. And we'd like to believe it's still a mom and pop business, but it's not. As populations have grown, as hospitals and managed care companies have developed and grown, we've seen the maturation of the medical space from a mom and pop business. Physicians don't really like that for the most part. But let's think about it. Grocery stores, they've now gone regional and national. Your local electrician, they've rolled up, and now you have regional electric companies that come and help you, pest control companies, gas stations. I remember the day when I got S&H green stamps. That tells you how old I am. And they wash your windows. Now you got Buc-ee's on every corner. And healthcare will never be Buc-ee's, but it was bound to change just by the geographic pressures and the population growth and supply and demand. We also had the impact of hospitals. Instead of being local hospitals, they became regional, and then they became national. And we saw the same thing in surgery centers. There were none, then there were a few, then they were ophthalmology driven, then they were regionally driven, then they were nationally. Now we have national platforms of surgery centers. So when you talk about the space for physicians, it's totally changed around them. And sadly enough, I can tell you I've been in more than 1,000 practices in my career, and less than 2% of them ever had a business plan, ever had a business plan. So how do you stay competitive as the world has changed around you? We can sit and be critical and say, oh, patient care is being driven by the private equity firms. I read all the stuff on the LinkedIn, and we're trashing all the way the system is. But what have we done as physicians to step up and try to lead? When they go to medical school, they're in medical school training for 8, 10, 12 years. Yet there's not a class teaching them on Business 101. Early in my career, I lived in St. Louis, Missouri. and I had an opportunity. I was invited in by St. Louis University to teach a business course to their medical class. And I went and had the topics prepared, but they were so tired and worn out from their training, very little attention was being given to what lied ahead and how they would go about building a practice. So I'd say to the physicians listening today, we've got to take some of this responsibility on our own to understand the industry has evolved. The industries continue to change, and it's going to continue to change. So let's just talk about challenges before we go to question two. Let's just talk about some of the challenges that are different today than we had back then. Well, costs and reimbursements would be the first one that would come to my mind. Back then, we didn't have savvy marketing agencies. You had yellow pages. Think about that. Most of the listeners here have never even seen a yellow page, but that's how the doctor advertised back then, was by the yellow pages. And so then we've seen the technology changes. The government convinced us that we all needed these fancy EHR systems, and to say that they aren't worth anything, that wouldn't be true. Paper charts were cumbersome. Can't tell you how many times I went into practices and they had storage buildings that they were renting to keep 7 years worth of charts, or they had these crank roll up tracking shelves to go find files for patients.
Yeah.
And so today we have a better filing system, but it was costly. And we were told that all the systems would speak to each other. That never materialized. And then most practices have had to change 1, 2, or 3 times cost for new systems or to keep up to date. So we've added cost to that. We've added regulations. I mean, we could spend all day on regulations. I don't want to spend time. I mean, for instance, the government rolled out at the beginning of January in the pain space WISER, right? So WISER was going to be the tracking mechanism in 6 states to do a test market on authorization, and we spent the last quarter of 25 gearing up for WISER, and those of us in Texas, where Pain Specialists of America is, and my doctors in particular, well, guess what? It's now June. I have 5 of them with gold cards already, but now the government's doing away with the program. So we spent all this time and energy and money, and regulation stepped in. And at the end of the day, they're just throwing regulation out. So I would like to see the government have more physicians step forward and listen to the marketplace. Come out here in a practice with me, shoulder to shoulder. Don't sit in Washington legislating. Get out here where the healthcare is really being provided and see it from the ground level before you make decision. And then also, we've had the strength of the hospitals and the strength of managed care companies. I'll be careful what I say here, but some of you know that they can be bullies at times. You can get excluded from a panel, or you can have a company in your region, a managed care company, that slows down payments or authorizations, and it costs you money. So the business has total different challenges than it did 25 years ago or 20 years ago. Now, I want to say before we go to question 2, do I think everybody needs to move toward private equity? No. Do I think every doctor is equipped to go out and get his own banking? Absolutely not. Do I think a physician, well-funded, can go it alone? In certain states they can, in certain regional markets they can, in certain outliers they can, but there comes a time where just the cost of staffing and the technology outsurpasses what an individual physician can do. I will never say it can't be done. I've seen it done. I can take you to places where they're still independent. And I salute that and I support that, but it's a challenge to do it their way. And what makes it a challenge is the following things that nobody wants to talk about. What drove the original practice model changes? It was retiring physicians who were reaching the end of their retirement and had no place to sell the practice to, because banks were less and less willing to step up and fund that buy-in. So the doctors were funding the buy-in for the next doctor practice and holding that paper themselves. And sometimes doctors just can't get along. So a lot of doctors ended up thinking they were selling their practice only to end up with hollow promises at the end of the day. And so that allowed an opportunity for another model to come along where the physician could get some consideration for the value of the practice that he built, and opportunistic changes allowed for the regionalization of management companies, private equity. There's been all kinds of different models that have been tested, and some are great. Not every private equity firm is good. Not every private equity firm is bad. So I would advise you as listeners to be certain that you research the transaction you're considering before you jump into it.
Yeah, and I was about to, even discuss, and I remember 10 years ago being in DC speaking at an event and going back to what you're talking about building a practice. And one thing, and the reason they brought me up there to speak real quick, I finished my presentation, did what I did, but I guess the other speaker wasn't going to make it. And it was a room full of graduates. And one thing I realized that when I started asking questions, I go back 10 years. And who in the room wants to open up their own practice? I get all the medicine stuff, but every hand went up in the room. I'm going to own my own practice. I'm going to change everything. And then when I started discussing what it takes to own a business, I pretty much killed. You could hear a pin drop because they don't teach any of that in medical school. They teach you how to be a doctor, all these other facets of medicine, but they don't teach business. So then when I do like with us, so we've been working with doctors for the last 10 years, getting in there and digging in, knowing numbers, top line revenue, bottom line revenue. I've seen the good, the bad, and the ugly um, in that. And then again, when you talked about exiting the practice, they think it's worth something when it's not. It's worth the paper that you're holding, um, or the equipment in the office, and that's about it.
And the equipment in the office is worth 10 cents on a dollar
Yeah.
nationally, right? Now, it
Yep.
doesn't mean that you haven't built a reputation and you don't have followers. But the truth of the matter is, it's not value building as the physician thought it was, and it comes down to risk. How much risk a physician is willing to take, and if he's willing to take risk, can he get the credit facility that's required to fund? And is that risk worth the reward? But let's go on to your next question. I think some of this will peel back answers as we move through.
Yeah. So, what do you believe are the key foundational principles you rely on to scaling a practice in today's environment?
I don't think through my career I varied on this, and I want to share them, and I'm going to be very clear, call them my 3 Ps, my principles, but the patient has to always come first. When you start looking at a practice through any other lens, you're going to make a mistake.
Yeah.
So the patient experience has to be first, and you have to look at the patient experience from every angle that you can. Close proximity to the home or business is what drives patients. Patients aren't anymore going to drive 2 hours to a practice. They may for a plastic surgeon, they may for some specialty care, but for the average physician, depending on where they live, convenience is important. So you got to look at it from the patient experience. The second part of that patient experience is, can they get an appointment under favorable conditions? It's favorable conditions not when we want to see them, it's when they want to be seen. And sometimes we don't look at it that way. So sometimes we need extended hours. And sometimes we need to be open on Friday afternoon. I have so many doctors that want to get employed by me. Oh, I don't want to work Friday afternoon. Well, part of business today is meeting customers and patients when they want to be seen. My second principle is our people. So patients come first, but our people, the people that we employ, we have to build into them, and they need to come second above profits. I never want to take away that profits aren't important, because I'm reminded by private equity all the time, profits are important.
Yeah.
But when you're running and scaling a practice, your patient has to be first, your people have to be second, your physicians have to be third. And let's stay with the physicians. I'm very specific on who we want to hire. We're not hiring people who want a job. We're hiring people who want a career. I'm fortunate that I live in Florida, but I run a company in Texas, 2 states where people want to live today, 2 states that have no taxes, no state taxes, 2 states where they have good education. So it's easier to recruit in a state like that, because the spouse, so many times, when I say so many times, that's 90% of the time, it's the fellow talk. They determine where the doctor's going to live because it's where they want to live. Is their family there? What's the stickiness? So I want to hire physicians who are purposeful about where they want to work, build a practice, raise a family, and retire. When you're just passing out jobs, you're going to have constant turnover, and constant turnover is too costly. The fourth thing is profits. So summarizing my 4 things is very, very simple. It's the patient, our employees, who are our people, our physicians, and then profits. But beyond that, I think 2 things that have guided me through my career is integrity is the number one value you have to have. So when you're lying to, so I have a rule when I'm recruiting physicians. I'm never going to lie to you, but I don't ever want you lying to me. Do we have a clear understanding of that, right? Because how many times physicians are interviewing and they had this long accomplishment list of what they've done, and they didn't leave their practice with any problems, and it's all great. They're just having, and then you find out, guess what? I had an argument with my partners. I have a substance issue. My production wasn't what it needed to be. And so my point is, I can help you with all those things, but let's be honest with each other where we are in life. And so truth and integrity have to be first and fundamental, because I believe that trust and truth um, go hand in hand. You can't have trust without truth, and you can't have truth without trust. And if we're going to build something meaningful together, the physicians have to be able to look me in the eyes and understand that they can trust me. If I say I'm going to do something, I'm going to do it. And if I ask you and say that we need to do something collectively together, I need to trust that they're going to do what it is we've agreed on to do together, because you can set the best business plans in all the world. Me and little Dougie, we can set all kind of strategies in the world. But guess what? Getting the doctors to buy into those strategies, that's a lot of fireside chats.
Yeah.
Because in today's business model, when you have private equity involved, when you have growth, most of those physicians aren't involved in the business side of it. They're there to see the patients, and we need to allow them to feel like they're in the business side of it. So I have a saying to my physicians: I'm not going in the operating room to do surgery with your patient, but I am going to invite you in the boardroom with me to understand how the business runs. So we specifically do town hall meetings with our physicians that are mandatory to come, and we talk about business. I also do a teaching lunch period where I invite my younger physicians in, and we have pinnacles of growing a practice, and I teach them business things, and they take their lunch hour to listen in and ask questions and learn. That's the only way I can get buy-in with physicians. And so those are my fundamental principles. I could go into a lot of other things, but at the end of the day, those are the basics that are required, in my opinion, to build a practice.
And I think you're spot on. And I'm going to give two examples. Two of our nine-figure guys that we worked with, um, one of their biggest things, you talk about the patient first. They built the systems around, when you see the practice is closed at, Friday at 1 o'clock, not open to do certain things on the weekends, and you limit yourself. When you put the patient first and build the systems and the process around that, that's how these two guys have scaled in the nine-figure range. And then the other piece that you met, and I got this off one of our doctors that now that has 14 locations that we work with, um, getting the doctor's buy-in. When he first started out working for somebody else, it was, well, here's what it is, and you're going to do it. And there was no input. You're just going to be a cog in this wheel, and you got to do what you're told. And what gave him the ability now to scale and grow and keep that loyalty was getting their buy-in, their opinions, their, listening to them as well. And now that's how you build a well-oiled machine, in my opinion. Exactly what you were talking about is collectively working together, having that open and honesty. Otherwise, it's a job. Here's what I
Right, and
got to do.
we call it guardrails. So we have to have guardrails.
Yeah.
And so first of all, we do things systematically the same throughout the platform. So let's remember, when you're hiring doctors, they're like free spirit horses. They all want to do things the way they want to do things. You can't run a business that way.
No.
You have to have, they can have their individualistic practice styles, but they have to be within the guardrails that we put in our operational guidelines of how we're
Yeah.
going to operate every independent clinic, and have them buy in. And then you have to manage backwards. That's why I have a chief medical officer, to manage backwards to make sure that they're staying inside the guardrails to build anything. And I say to physicians all the time, guess what? If you own this practice yourself, would you cancel that patient that's called in at 3 o'clock and wants to be seen? No, but because I own it, because private equity owns it, you're willing to say, oh, no, don't take that new patient. You think I won't find out about it? I do find out about it. And then I call them and say, why'd you cancel that patient? And so that is part of the challenge today as we have an employment model. Physicians today, I'll call it lifestyle. I'll be kind. They come to me and interview, and they want off Friday afternoons. They want 8 weeks of vacation. They want to be paid the top dollar. but they don't want to. They want to work 4 days a week. You just can't do it in today's environment, and you might as well admit it. You got to say no, and no is an answer to a yes, right? I mean, so you're either going to have people that understand it, and if they owned it themselves, they would work 5 and 5.5 days a week to build something. So let's go to your next question, so we don't run out of
Yeah.
time.
Yeah. So what do you see as the biggest headwinds today? So we talked about then to here. So moving forward, what do you see as the biggest headwinds?
So there's multiple headwinds out there. It can depend on the region of the country that you're in because healthcare is local and regional. I hope everybody hears me on this. I said that 25 years ago and nothing's changed. We try to make it national in scope, but it's not.
Yeah.
Healthcare is local and regional. It's different on the West Coast than it is in Texas, than it is in Florida on the East Coast. So we need to understand that. So at the leading driver of all of this are costs and reimbursements. I did a lecture at a brain trust last fall, and somehow on the I was on economics. That's what they wanted me to speak on, and I did a slide. I wish I would have brought it today. It showed that the reimbursements that we were getting in 2020, I mean 2000, over 26 years, we're actually below where we were 26 years ago, but costs have increased 75 to 100%. And that continues today until we get a handle on this. Going to be fighting that cost reimbursement thing. So that is a challenge. So cost is always at the forefront. In Congress this week, I saw somebody trying to pass a bill that minimum wage was going to be $25. I was like, whoa, boy, that's going to change my front end. I'm going to have robots pretty soon
Yeah.
in my front end. It didn't pass yet, but we don't know where that's going to go. But a staff cost is an issue. Physician cost is surely an issue. And I'm not saying physicians should be paid less, but starting compensation for a pain physician 5 years ago was 350 to 375. Today, if you can get the best there is for 550 or 600, you're doing well. So that's a huge increase for the workload that's going to go out there. So physician costs are one. Technology costs. To say technology, yes, technology helps your practice, but the cost of it, when you add up the seat licenses for your technology and the different platforms scaled to it, the cost of technology is ever growing. Then we have the addition of AI, which I'm for AI. We've added AI into our practice. We're doing it with a very guarded eye because I think it's going to change. It will reshape how we do business, and it could reshape the customer experience if we're not careful. But deployed cautiously, it should bring us a lift, but there's still a cost for doing it initially. And so that's a headwind because all of us don't understand it and it's changing so fast. And then we have governmental regulations coming into this. So some days and some weeks in running a company, you're running from project to project to project. Each one of them has some AI into it, and you're trying to make sure that you don't leave yourself vulnerable for an AI crash, which can happen, right?
Yeah.
And so I would say another concern that I have is the direction of the governmental payers. And what do I mean when I say that? You know, in Texas, we have large military bases, and we saw 3 years ago they changed reimbursement, and that had a huge impact to us. And they lowered the military payments to a lower rate, to Medicare rate. It had a huge impact on company profitability. I'm not saying it was wrong or right. I'm just saying it had a change. Every time the government makes a change in Medicare reimbursement, to me, they don't do it on the quality of care issue or the value to the patient. They're doing it on the volume of patients that are being seen nationally or regionally to control the cost of Medicare. That's a dangerous way to manage the healthcare costs in our country. And it leaves us at the practice level in limbo and planning because it's taking reimbursement away. The commercial payers can even be worse, but they get away with delaying authorizations. They get away, and the cost of just managing authorizations in a practice today is ridiculous. But the delays in payments and how many you can do the best job there is at making sure your claims are clean the day they go out the door. There'll still be a denial come in for some reason.
Yeah.
A couple of the payers today, if you could send the paperwork along with the case to show that the paperwork's there, but they want to deny it first, before they then say, well, send the paperwork. Well, if you'd send them simultaneously, we wouldn't have had a delay in the processing. So the delay in all the governmental regulations, the managed care regulations that actually have a lever over the physicians, and it leaves us in limbo. And so there's going to need to be some scale where the physicians band together and have a voice at the table, because left without a voice, it's going to become a harder and harder business. I don't want to make it seem like a doom and gloom. I'm in this business. I love it. I'm passionate about it. I think the physicians should control patient care, but they should really control it. They shouldn't have to be begging to get imaging. They should have to be begging to get your new type of imaging that's out there, but you're going to see that as well. I mean, there's all kind of new technology coming out there. The doctors should be the ones that are determining what the patients need. And actually, we need a better way that we value care and we see improvement on patients and give physicians their right due for getting patients well and keeping them out of the system. I would be remiss in saying, the pharmaceutical companies are making money off everyone's back because you deliver a lot of pharmaceuticals into the space today.
Yeah.
And it does create a problem. And hopefully it's going to be addressed and see some of that. But all those are headwinds for us, and there'll be new headwinds. Just as we produce this podcast out there, something will come up that we haven't even thought about, and
Yeah.
someone's doing a change. And so what I think is the best thing I can advise people on headwinds: have a strategic plan, and then have a backup plan, and then be flexible to both those plans, because it's going to change. Just when you get the ink dried, your strategy is going to have to change. So learn to be flexible would be the goal that I would have for everyone.
Yeah, and I totally agree with that. Even with us on our end, we understood that. That's why it's not just, hey, you're buying a piece of technology. We have an entire support team, and we even have a billing support team because we know how vital that is. Because again, if you get denied, you got to go through all these steps. That's why it benefits all around that. Hey, you know what? We have from marketing liaison to patient coordinator to billing support. You got to come with the support team behind it, to ensure a smooth transition and be able to pivot. It wasn't there in the beginning, but it is there now because
But
we knew the importance
that's
of
how
it.
all businesses evolve, right? Just like
Yeah,
you've evolved this. But the point of it is, you got to get the physician buy-in and believing where you're going before you can
yeah,
get there. And then the team you put behind them, because the physicians don't have time to do it all.
no,
No, they're constantly griping about the paperwork and the clicks on the system that they have to do today, which is more than they did before.
yeah,
Because you have to validate every single decision that you made, from a legal compliance so you don't get sued, as well as to get the case paid. And that's why we see a lot of physicians just going self-pay, or
yeah,
some going Medicare and going away from commercial pay. I see it more and more, and some going personal injury.
yeah.
And
We
just
work with a
saying,
lot of them.
I'm just saying, I'm not going to be in the orthopedic space anymore. I'm just going personal injury. I'm just going to do it. And so there are all kinds, but we can do better than we're doing today. We just need a voice at the table, and it can't be one-sided. The physicians also can't be greedy. I'm not saying they are being greedy, but there needs to be a reasonable voice at the table for what works and how best to deliver care, because care today is delivered totally different than it was 20 years ago.
Without a doubt. Without a doubt. So what piece of gold nugget would you like to leave us with today? And let's aim this towards physicians that are out there. So what parting piece of information will you leave for the doctors that are listening and following us through all these media platforms? What could you leave them with today?
Here's what I say: you had a vision and a dream to become a physician. Don't get discouraged by the naysayers. Follow your passion. If you started out to want to own a car dealership or a grocery store, that business changed as well. Healthcare has changed. It's going to change again. From the time you started medical school to the time you finish, it's going to change. So what I would say is, live your life's dream. If patient care is what you want to do, find the place you want to do it in, with the person you want to live with as your significant other. Have values that you believe in. Join a practice or a group of people, independently owned or private equity based or hospital owned or you can thrive in that and give the best you can to what you dedicated your life to be. Standing around and griping about reimbursement or how many hours you have to work or you don't want to work, I would say write down on a piece of paper, do the Ben Franklin. This is what I went to school to do. I need my income to be this. I'm willing to sacrifice this. Family should come first. I tell all of my physicians, I'm a family first person. You're going to have some sacrifices, but it can't be every night or every weekend. You got to put the family first. You got to decide where you want to live and who you want to live with. And the other things will fall into line if you work hard. You can't come into this saying, you know what, I just want to do my 6 hours a day and get by. It's not a business for that. You might have thought that's the way it was going to be, but it's not that way. Maybe doctors today, in some regards, have to work smarter than they did 10 years ago. And maybe they have to work the same hard, not harder, because doctors 10, 15 years ago, they'd work 6-day weeks if they had to. They'd work 10-hour days. And some doctors are still doing that. I still believe you can do it in a 40, 45-hour week, but you got to write it down, plan your plan, have a concept, find a partner that you can, a spouse that you want to live and enjoy life with. Life is too short to try to buck the system. But you went to school for the purpose of being a physician. Enjoy it. I salute you. I'm your supporter, but there are ways to make it easier.
Thank you for your insight. This was fantastic. I really appreciate you taking the time out to be on here, answer these questions at this higher level. Doug, on a personal level, thank you for being on the podcast. I really appreciate it.
Thank you, Sam, very much for the invitation, and I hope your listeners enjoy it.
Thank you.
Have a good day.